Now, the Health Minister, Dr Zweli Mkhize, says an additional 20 million COVID-19 vaccine doses have also been secured from Pfizer. This brings the total number of vaccines secured from AstraZeneca, Johnson & Johnson, and the COVAX vaccine facility to some 40 million. We're joined now by the Minister himself. A very good morning to you, Dr Mkhize. Thanks for joining us, as always, here on the AM Report. What an incredibly exciting day for our country, the biggest vaccine in our history, shrouded perhaps in some shadow because of the fears around the possibility of corruption creeping into our system. Minister, what can you tell our country today about how prepared your department is to ensure that all of these vaccines go where they are meant to?
Well, it is an exciting day, I think, for all of us. There was quite a lot of anxiety earlier, and we kept indicating that we are on course to receive the vaccines, and we're trying to get them in as early as is possible. And we must say, therefore, that today we are confirming that they will be landing in South Africa, the first 1 million doses, and there'll be several more coming after that. So we want to first say that to our people that we have to work together. We need to hold each other's hands. We need to support each other to make sure that this vaccination program is a success. We will need people to come in their turns, in their categories, so that everybody gets a turn in getting their vaccines. And therefore, we need to just give each other time to work through the necessary safety measures, such as the quality assurance that's going to be happening, the question of the stock taking, the verifications, all of that needs to happen so that we go through. By the way, it's not just this, it's all the vaccines that we get. We go through the same kind of quality assurance. We can just assure our people as well that we have learned from the PPE saga that we will make sure that we have no corruption in the procurement of the vaccine. Treasury and the Department of Health are very tightly working very closely to make sure that we limit numbers of people who can actually participate in the procurement, so that we don't have multiple centers where we have no sense of how things are being managed. So Treasury is looking very closely. The Chief of Procurement Officer is working very closely. So we'll ensure that in the procurement there's no corruption. We also are going to be looking very tightly on the area of distribution and logistics to avoid any form of corruption. However, we want to assure as well our people that vaccines are going to go to each and every province. At the moment, we've already allocated numbers for both public and private to be able to receive their vaccines. So we are going to give attention to a fair distribution of vaccines, and we request our people to be out on the lookout and support and promote the vaccination program.
So Minister, I want to hone in on the statement you just made, that vaccines will go where they are intended. But the fact of the matter is, Minister, our vaccines will not be barcoded. In fact, this is not a new issue for our country, this issue of tracking and tracing our medicines. So how will we ensure that vaccine A will go to person number 1 and so on?
Well, the way the batches have been made, the barcoding itself is not a problem. What will happen is that people are going to be vaccinated in the batches that are going to be properly recorded. So the nature of the batching is such that we will always know who got vaccination from that particular batch, and therefore that should be safe enough. The issue of barcoding is not happening in the manufacturing, because they felt that it's not going to compromise the safety of the recipients, and our system as well is going to make sure that we get proper records as to who gets from which batch.
So, Minister, healthcare workers, the first to be inoculated, this first 1 million doses that arriving in the country today, does that mean, because this is a 2-dose vaccine, that 500,000 healthcare workers will be vaccinated with this first batch?
No. We're very optimistic. We're working on plans. We don't announce everything until it's all sorted out. But I can just say to you that we're going to give these doses as first dose for everybody. So up to 1.5 million people must get those doses. And then, of course, before those doses are even finished, we will have enough vaccines to be able to cover the additional second dose. So all of that will be announced in due course. But at the moment, the 1.5 million will go as first dose to everybody, and then there'll be a second dose after that, and of course we'll move to the next level. What for me is quite exciting, is the fact that we had actually put up 3 months for the first phase, which means that for the first 1.5 or so million people that we would like to target, we should get as many of them as possible to get the first and the second dose within 3 months. And thereafter, we start a second phase, which should last about 6 months, but we actually are trying to overlap the phases so that even before the end of the 3 months, we are able to start on the next group of frontline workers, the teachers, the police, the taxi drivers, the social workers, people who work in offices, municipal workers, anyone who works in a setting where they could be sitting and serving community, but someone unknowingly could infect them. And so those are the next batch of people, including those who have got comorbidities with diabetes, with HIV, with TB, with renal diseases, and so on. All of those need to be dealt with as one group, and we're estimating about 16 million in that category. And we've said about 6 months should take us about 6 months. And beyond that, of course, we'll then open up to everybody. But this is to say those who have got a risk of getting infection must be attended to first, because this is a fair distribution. So the elderly and so on will come on the second batch, and those who are frail, who need to be given protection, will all come on the second category, which should happen hopefully earlier than the period that we originally planned.
Minister, you're quoted in weekend media reports that government officials will also be inoculated among this first batch of vaccines to apparently boost confidence in the vaccination plan. Can you confirm this either way?
You know, we were discussing here about the debate, and the debate was, do you get civil servants, political leaders, religious leaders, prominent leaders in the forefront or not? And that debate is open. I don't decide on that, but the issue was, it's important for us to actually create a sense of confidence. People must see everyone going out there, the leaders leading in front to say, yes, these vaccines, we're prepared to go through them ourselves, so that that boosts confidence. We have said so because we are basically part of that discussion. We have not taken any specific decision, and it won't be my decision. But you also have other people who are saying, no. Political leaders and religious leaders or traditional leaders should not be in the front. Let the people go into the vaccination program first. They should be last. But it's a nice debate. It's really a question of saying, for us, it would be important to say that when there's a bit of hesitancy and people are not sure, some leaders must actually be in the forefront to show that they are prepared themselves. Because some people worry about, are you still trying these vaccines? And we're saying, no longer trying them. We are now using them. They've been tried. We know that they've been safe, and therefore everyone should feel free to go through. So the question is really who takes the first jump, and that's really what we're discussing. But there's no specific decision there. But I'm saying it's an open discussion. Let people talk about it. But we will get the government to give us a guide in terms of how that goes.
Yeah, you'll keep us up to speed on how that develops, Minister. But earlier you were saying to me that you don't always announce all of the plans of government when it comes to the vaccine rollout plan. Having said that, there is a sense that there is this veil of secrecy around our rollout plan, that there are still a number of questions that are unanswered in terms of exactly how the provinces will manage the vaccinations themselves. Do you think, looking back now, Minister, that perhaps the communication from your department could have been better, that there could have been more positivity, more assurance given in how the vaccination rollout plan is going?
Well, I think we must always try and get a balance of some sort. I think that some of the criticism was completely unnecessary, and some of it was something that was based on anxiety, in which case it was important for us to explain certain things. But, when you're handling a very dynamic matter such as this one, it's always difficult to know at which point do you release information, at which point does it compromise what you are doing, at which point do you raise an issue that has not been fully processed. And then when you get asked questions, you say, well, we're still working on it. And then people think like you're hiding something. Like now, when we're talking about this issue, all I'm saying is that there's a lot that we're working on, but because the other side, the other party hasn't concluded and confirmed where we cannot then give you details of that. And because of that, it doesn't mean there's secrecy about it. But, in some instances, we expected to say things that are not fully processed, and I think it's unwise to do that. So there has to be a balance. I would say that, yes, we should communicate more and we should explain more issues, but I also think we need to be given space to understand that there are some of the issues are not ready for public consumption until they are fully concretized. And then sometimes you get people who go for gossip. They hear so and so said this, there was a source that said that. All of those things, they create a cloud of uncertainty, when in fact it's not called for. In this case, I believe that we have done everything that needed to be done. And so we need to increase on communication, because there's lots of people who have got, fake news, social media reports, and they are worried, seriously worried, and we must address those issues. And others believe in different things. And so we need to open up the debate, but we shouldn't create a sense of so much suspicion as to make a normal, straightforward program to sound like there's someone who's trying to hide information. So, like, for example, we want to go to court to say what is happening on this. It's not necessary. As far as I'm concerned, what is important is that we must ask questions, we must actually scrutinize what's being said, but we must also come out and give more information. But there's no point in giving information that's not verified.
Yeah.
I think it's very unsafe to do that.
Yeah, I mean, I think you can also agree, Minister, that we are a jaded nation. We can't help but be suspicious given the levels of corruption in our country, not least of which, if we relate it to the COVID-19 pandemic, the corruption we saw in the rollout of personal protective equipment.
When there's a basis to be suspicious, we have to be suspicious. When there's no basis, we shouldn't be suspicious. In the case of corruption, I think that one is correct. That South Africans have to be they have to be vigilant. We've seen something wrong, we must actually talk about it so much that in fact it must be stopped. And I agree with that entirely. And so when we're talking about corruption, and we have to ensure that in this vaccination program there's no corruption, I agree entirely.
Yeah.
But when we say we're working on a plan to supply vaccines, and we say it's going to arrive, earlier than the dates that were announced from COVAX, we shouldn't raise suspicion and make it, because there was something wrong in corruption somewhere else, even on this one, there's something wrong. We must deal with it when there are problems here, then raise that to say, yeah, there are problems. Then we are, I think, on course.
Yeah. Minister, I want to talk to you about the efficacy of the vaccine, because you mentioned over the past few weeks, when you've been updating the country every single night on the new COVID-19 numbers, that the South African variant is now responsible for driving up the infection rate that we've seen over the past few weeks. In terms of efficacy of the vaccine, what do we know about how effective it is against the South African variant?
Well, very good question, because I think when we deal with this issue, we must deal with this on the basis that we're led by scientists. They are the ones who will, research and tell us what is happening. Firstly, what we know about this variant is that most of the second surge is being driven by this new variant, 501YV2. And that variant is a unique variant, which we have seen here, but also other countries are seeing different variants, although some are seeing variants similar to the ones that are in South Africa. Secondly, they've done some tests to, let me first say that all the prevention measures and the treatment case management approaches that we have used for the other variants still work on this one, which is why it was important for us to insist on use of mass sanitation and distancing to deal with this particular variant, so that the prevention doesn't change anything. Then the question becomes, would people who have had this the first variant be infected by the second variant? It seems, yes, that is possible. And in some instances, it could have actually already happened. So we do know now that in some cases, some of the natural immunity acquired in the first infection may not necessarily work on the second variant, so on this variant. So on that basis, we therefore are saying that the scientists must tell us whether the vaccines that were prepared for the COVID-19 virus earlier would still be effective. Now we've seen different results coming from different manufacturers that have said that they think it is effective. They give percentages. I won't spend time on the issue of percentages. However, what we're then saying is that we've set our researchers to go and research to come back and say concretely, this vaccine has got this level of efficacy against this new variant, that vaccine has got that, and so on. With all of that, what do we make of it? But in the meantime, we believe that whatever protection we can get from the vaccines that as they exist now is still very, very important, because the COVID-19, the virus, has got various variants which could still be covered by these vaccines. And therefore, if there's anything that needs changing, we'll hear from the scientists. So at the moment, we are saying we are investigating, researching that aspect. We'll have a proper announcement in due course.
Dr. Zweli Mkhize, let me thank you for your time once again here on the AM Report. It's always a pleasure talking to you, and all the very best for what is an incredibly big day for our country. The first 1 million vaccine doses arriving at OR Tambo International Airport this afternoon. Thank you, Minister.